In this presentation, we will cover state and federal regulations relevant to FES organizations. Most FES providers are either a part of state or local governments, or they are independent volunteer fire companies or EMS organizations. State and federal regulations are a product of the government fulfilling its role to protect its citizens and to mitigate market failures that may be preventing a public good or service from being available. Governments create regulations when consumers lack the knowledge necessary to understand risks. An example of this are regulations that require certain information on food products. The average citizen has no way of knowing what is in food that they are purchasing at the store if that information isn't required to be on the label. State governments and the federal government regulate most professional services such as doctors, lawyers, and engineers. In these professions, there are certain minimum licensing requirements. Becoming a professional firefighter or EMS provider requires extensive time and specialized training programs. The training and certification requirements are a way of making sure that each professional responding to an emergency call is competent and capable. Otherwise, citizens have no way of knowing that the professionals that are responding to their call are qualified and competent. When creating federal regulations, Congress leaves much of the details up to experts working in the bureaucracy. Members of Congress lack the expertise in areas that need regulation, so they pass legislation that gives agencies the room to create regulations they see necessary. In 1970, Congress passed legislation that was signed by President Nixon, creating the Occupational Safety and Health Administration, OSHA. The goal of OSHA is to help employers and employees reduce injuries, illnesses, and deaths on the job. Since its creation, workplace fatalities have been cut by more than 60%, and occupational injury and illness rates have been cut by 40%. States can decide to adopt OSHA regulations, which makes them enforceable for state and local governments. Volunteers are not considered employees, they are considered independent contractors, so they are exempt from these regulations. Most states and many local governments adopt building and fire codes that regulate the construction and maintenance of structures. However, state and local governments often rely on the NFPA and the International Code Council to set standards. Several OSHA regulations are particularly relevant to FES organizations. The first, shown here, requires training, proper equipment, and written procedures for employees who enter areas with limited or restricted means of entry and exit, such as trenches, pipes, tanks, and vaults. The second requires that 4 firefighters be on the scene before an interior structural fire can be attacked while using self-contained breathing apparatus. The third requires employers to reduce or eliminate employee exposure to diseases that can be transmitted by bloodborne pathogens or other potentially infectious materials. The fourth requires that all firefighters and emergency responders be trained to a minimum competency in handling hazardous materials. Interestingly, at an institution I taught at prior to coming to BGSU, all of the faculty had to complete training in handling hazardous materials. I have no idea why, since I have never had to deal with chemicals at work, But sure enough, I had to know the standard operating procedures for disposing of hazardous waste on campus. Completely ridiculous, really. Anyway, the last one on the list here requires things like an organizational statement on safety, protective clothing, and respiratory protection for employees. The NFPA was formed in the late 1800s by a group of insurance companies who met to address the inconsistencies in the design and installation of fire sprinkler systems. NFPA standards have been covered in previous sections of this course, but two are worth mentioning now, too. NFPA 1500, Standard on Fire Department Occupational Safety and Health Program, can be thought of as an umbrella standard that includes standards on firefighter qualifications, fire officer qualifications, standards for fire training, standards on medical requirements for firefighters. NFPA 1700, Standard for the Organization and Deployment of Fire Suppression, requires minimum staffing levels, response times, and training. These NFPA standards clearly apply to fully career fire departments and apply to some combination departments, but much like the OSHA standards, fully volunteer departments are in most cases exempt. This presentation covered state and federal regulations related to FES organizations. Specifically, this presentation outlined several relevant OSHA regulations. In addition, we covered relevant FPA codes and standards.